Well, thank you all for coming to what is actually my first poster presentation ever. A little bit about me is that I am a very late career PT, kind of a mid-career educator, but one of the reasons I wanted to work for the university is the opportunity to engage in research. Even at this late stage in my life, I decided to go ahead and enroll in a Doctor of Health Science program so I could understand better how to do research. And this is the poster from the paper that we're hoping to publish soon. And a little bit about it is, so the other thing is, this is my first poster presentation. My next poster presentation is tomorrow morning at 7 a.m. up in Long Beach. And so for those of you who are not familiar with Southern California, that's about 3 hours from here. So I have to leave home at about 4:30, 5 o'clock in order to get there on time. But this will be 2 poster presentations in 24 hours, so I'm stoked. So a little bit about this presentation, or at least a little bit about this work. I'm getting my degree through the the University of the Pacific up in Stockton, and the team consists of the first author here is John V, who is a PharmD from India, who's here getting her master's in pharmacy from the University of Pennsylvania, Pacific. Myself. The next 3 authors are actually undergrad PharmD candidates. The next one is a doctor of osteopathy and a professor at the West Virginia School of Osteopathic Medicine, and then the last is my mentor, Deepti Vyas, who is a professor at the University of Pacific School of Pharmacy. And basically, this is kind of like a secondary analysis of one of those, we got to figure out how to do this during COVID times, where basically students from the pharmacy school at the University of the Pacific and Doctor of Osteopathic Medicine students from West Virginia School of Osteopathic Medicine basically sort of teamed up online to basically go through a interprofessional intervention looking at patients who've experienced a stroke. And as it says on here, so the purpose is to understand the impact of interprofessional education module on student knowledge and attitudes regarding post-stroke disability and changes in quality of life. And again, each team composed of 1 student from each program. There was a case that was developed in a simulated electronic record. They also had the ability to observe the patient who displayed some of the impairments that all of us probably on this call are familiar with: left-sided hemiplegia, aphasia, cognitive impairments, things that again are again germane to our practice but not to theirs. So the next kind of shows the breakdown of the process where they did individual training. Then they would actually do an individual workup with the teams, discuss the roles and responsibilities. Then they would come back to a discussion and then upload a SOAP note plus a post survey, a survey afterwards, and a peer evaluation. So what we use as an evaluation tool is, one is the tool called the SPICE-R, which is a validated survey of interprofessional education. I could actually post that. Actually, I won't do that now, but if someone's interested in it. And then the original authors came up with a 5-item disability attitude survey, which again was not validated, it was just internally used. And then they were asked an open text question: what were some of the things you had not considered prior to IPE? So again, it was kind of a mixed method, quantitative and qualitative. So we used a pair t-test to look at the data before and afterward, and then some of the descriptive statistics were used for the self evaluation. So basically, we kind of combed through the 700 and something responses from the students to see what were common themes. So the one good thing, and what's not surprising, is that the students actually had improved attitudes toward interprofessional teamwork, the roles and responsibilities, and patient outcomes. So as it says under the SPICE-R statements, working with students from different disciplines enhances my education, and there was a significant improvement in that. Participating in educational experience with students from different disciplines enhances my ability. Again, not surprisingly, there was an improvement there. Health professional students from different disciplines should be educated to establish collaborational relationships with one another. During their education, health professional students should be involved in teamwork. So again, all things that are unsurprisingly improved regarding teamwork, regarding roles and responsibilities. Again, my role is clearly defined. The students felt that there was more clearly defined after the intervention. They understood the courses taken by training requirements of other health professionals, again, significantly improved. They understand the roles of other health professionals. So just kind of reading down through there. Again, not surprising that there was an improvement. Then going down to the reflection, so 34% of the students had mentioned that they had not considered the physical impairments and the subsequent functional disabilities associated with stroke. And then again, about 20% of them hadn't. 1 out of 5 had not considered the impact of the stroke on the patient and the family afterward. Kind of going back through what I remember reading is that mostly was focused on, obviously for the pharmacy students, TPA and focusing on the pharmaceutical management of high blood pressure and all the things that would lead up to it. The osteopathy students, again, primarily focused on the medical consequences, and none of them really considered what's germane to us, which is kind of why I was interested in jumping onto this project. Yeah, and again, looking at the survey, that the one that was unvalidated, are they recognizing the different types of disability associated with stroke, discussing strategies for improving quality of life, again, improvements there, discussing expected disabilities associated with new stroke. So all these things, again, were unsurprisingly improved. One of the things I guess is not on this was I did a U test actually to see what the differences were in between some of the students. So that was kind of interesting in that, again, many of the students didn't understand what the other professions' roles were. So just to kind of wind this up is that, so as the conclusion says, this IPE activity contributed to improving student knowledge and attitudes towards post-stroke. Again, this is one of the reason I kind of jumped on this. The limitations are we could have considered more disciplines. And that's why I think the idea is to take this further and include the rehab disciplines so they can understand maybe the roles that pharmacy plays. Again, the students didn't get to act with the standardized patient, again, largely due to the fact that at that point that everyone's in lockdown. And again, the disability survey, which I think has value, has not been validated. So again, doing this again with, as this down here says OT students, as a nod to Mo out there, but this would have been, future directions would be to include the rehab sciences, the rehab therapies, including speech pathology, and using the standardized patient. And again, one of the other future directions would be to actually validate the disability attitude survey that we used. So that in a nutshell is my first poster presentation. So if anybody has any questions, I'd be more than happy to answer them if I can.
Great job, Dr. Concors. Yay, go, go, go. I'm so excited to see you doing your posters and going into research. I just had, my question was on the SPICE-R. We use the SPICE-R too. So if you do another survey, I think that was the update of the SPICE-R, which is another validated version. So if you do validate the disability and then maybe look at the SPICE-R too, that'll help you have that, I guess, the most recent version of it.
Okay.
Because I use that for my research as well, but I've seen the SPICE-R and the SPICE-R too, maybe I think it's 10 questions, but that'll help you look at that tool at the next iteration for your continued research.
Oh,
But
thank you. Yeah.
great job. I love the validation of another tool and looking at how that coincides with the SPICE R2. And so, yeah, great research.
Okay, thank you.
Very good, Andrew. It's so exciting to see that you're on this path as well, because we can't get enough IPE, I think. My quest last time I was at the International Meeting of Simulation in Healthcare was to find an assessment tool that did both. So it was student perceptions, but also faculty perception. So it could be more of a more accurate grading, because I feel like a lot of the student perceptions are maybe higher than what faculty perceive. And I couldn't find anything. So I'm on this quest to maybe we can put our brains together as a university and come up with a tool that's very specific to OT, PT, speech, nursing, that's at the academia level. That's not just student perception.
I see. So our rating of what they've taken away from it.
Yes.
Yeah, that's a great idea.
Yeah, because sometimes I see the students rate themselves very high, and my perception was a little bit different.
Yeah. And again, one of the things I think is important these days is also maybe including patients who have experienced these to say, well, what matters to them, right? And then are the students getting out of this? Are the faculty even getting out of this? What a person experiencing it really wants to have exposed. So that's another option, I guess, huh?
Correct. Yeah, including the SP's point of view. Absolutely.
Yeah. Oh yeah, definitely. And Andy, like we try to submit to the Journal of Interprofessional Education. So what you exactly just said is the effect on patients. They told us we can't do yours because student perceptions is not that higher level. But if you can do that, you're going to be published at the Journal of IPE, because you're now looking at how the IPE is affecting patient outcomes or something outside. So yeah, faculty perception or patient or definitely take that, and you got a nice little research piece.
And actually, now that we're talking, then maybe this is something that, well, not that we don't already have full plates, but since we already have pro bono, maybe including those patients and say, okay, let's use those IPE opportunities, obviously, because pro bono is a big thing in my research interest, to say, okay, from a patient standpoint, did this did we address what you thought was pertinent? Anyway, yeah, thank you.
That would be, take and run with it. That would be fantastic.
Absolutely.
Anybody else? Oh, is there something in the chat? I'm not sure if that's something related to me. No, it doesn't look like it.